so as it becomes more relevant to both of you, because this was designed for a certain age group, but now since we have a different age group, so we will mold it accordingly so that it can be useful to you. Okay, fine. Now tell me something. How many of you think, what is your opinion about sex during pregnancy? Okay, one should avoid completely sex during pregnancy. What would you say, sir?
I think after a certain time period, there is no harm.
Okay, so what is that time period?
If you take care of the proper conditions.
Wonderful. See, basically the reason is that the reason we have decided this topic is, it's a small topic, but it's of immense importance, and that is the reason why this particular topic was decided. Let us first of all see what happens to a woman during her pregnancy, especially her sexual desire during her pregnancy. See, we need to understand one thing, that three things may happen. For some women, the sexual desire increases during pregnancy. For some women, it would remain the same, and for some women, it decreases during pregnancy. So there are no uniform answers whether every woman would act or behave in the same way. So as I said, there would be three different situations. A woman would have an increase in her desire. Some set of women would have the same set of desire, and in certain cases the desire actually decreases. So naturally then we are left with three answers. For women whose desire increases, and if she wants to have sex, the husband can have sex with her. If her desire is constant, whether she wants it or not, depending upon that, the husband can have sex. And if she has a low desire, then the husband has to have some patience and try to have sex with her only when she desires. Right? So this is the first thing which we need to understand. Now, having said that, pregnancy is something which is going to last for 9 months, right? And after the birth of the child also, another 42 days, right? After the birth of the child, another 42 days you need to avoid sex. In certain cases, even 1 year after the pregnancy. Now, just imagine 9 months plus 42 days. So that is about 45 days if you assume 1.5 months. So 10.5 months plus 1 year. Now it's very difficult for a man and a woman to avoid sex for such a long period of time. Right? Do you all agree with that? I would not say humanly it's impossible, but it is difficult for very many couples to follow this kind of strict routine. So let us see what are the things a man and a woman can do during pregnancy. Okay, would you have any suggestion apart from sex? What can they do? See, this is the time to use, we are so blocked, we think that sex means only sexual intercourse. But let us try to see what are the other options available to any couple who wants to have sex. What suggestion would you have? With your own understanding or with your own capacity to imagine, what are the things a couple can go for?
Apart from the sex?
Yes.
During pregnancy, I think
Not should have sex.
not say nothing.
Nothing. Okay, what would you say?
You can have a lot of foreplay and
Okay, that is different thing. Like hugging is different thing.
don't have to have penetrative sex.
Yes. So what options do we have apart from penetrative sex?
You can play with.
Okay.
You can
See,
enjoy touching body, enjoy each other's company, talk to each other a lot. It's a lot of emotional satisfaction you derive from that.
see, let us see the different options which are available to a couple without having penetrative sex. One would be oral sex. Okay? The woman could perform fellatio on her husband, or the man could perform cunnilingus on his wife. Right? And fellatio and cunnilingus are oral sex words for the man and the woman. They could even give each other a sensual massage. Unfortunately, there are very, very few couples in India who actually know what is a sensual massage and how to give a sensual massage. But I'm sure there must be some books in the library over here, or even on the net if you check. There are sites where you can really, they are very demonstrative, they are very nice, and this is something which every couple can enjoy.
Massage is okay, but I think the oral sex is unnatural. It's not unnatural.
No, I'll tell you something, oral sex is not unnatural, because there will be times when your partner is not in a mood to have, like coital sex. But still, oral sex is as satisfying. There are so many women who reach orgasm only during oral sex. So what would you do with those women? Right? And it is very, very satisfying both for the man and the woman. So there is nothing unnatural about it. It was only during Christian times that, people thought anything less than penetrative sex is no sex. But now so much of research has happened that people are finding satisfaction in not many activities apart from penetrative sex. Right? So even that is fine.
I think there is a lot of fear in the mind of both, that it may lead to some infection.
Yes, we will come to it later on. How we will try to work on that. They can even get into something known as mutual masturbation. Right? The man masturbates the woman and the woman masturbates the man. What is so good or bad about it? It is something which gives satisfaction to both of them. So they can even try doing that. But certain things they need to understand is during the first trimester of her pregnancy, that is during the first 3 months, her breasts become very, very tender because a lot of hormonal changes are taking place. So if a man is fond of playing with the wife's breasts, he has to be slightly careful so as not to irritate and hurt them. And if the woman does not like it, she has to tell her husband that, you please fondle my breasts in a slightly non-aggressive way. So that she can always do. Okay, any questions or anything you have? Okay, so these are certain things which can be done throughout the pregnancy, these things. But one thing we need to remember is when a man is performing oral sex on a woman, he cannot blow air inside her vagina. That he has to be very careful, because if he does that, the air will go into the woman's bloodstream and into the fetus. Right? So that he has to be careful. If he does not know the technique of giving oral sex, he has to go and see a sexologist who will help him out with techniques and things like that. Okay. Now, coming to his question. Many couples are afraid that the fetus will be hurt. Right? But actually what happens is there is something known as a mucus plug. When a child is settled inside, the fetus is inside the woman's body, the uterus is actually closed through a cervical OS. So there is no question of hurting the baby. Right? The man's penis will not touch the fetus's head. No, the semen will flow out of the body because the mucus plug is closed. Right? It is something like this. See, it's something like this. This plug is actually closed. This plug is closed. So in any case, the semen is going to flow out of the body. Right? So there is no harm, and it cannot even cause any kind of infection because this whole area, as I said, is already closed. Right? So some people, they think that they will injure the baby if they have sex. The wife thinks like that, the husband thinks like that. But that is a very baseless fear. It doesn't hurt anyone. Okay. Now, having said that, there are certain contraindications. Contraindications in the sense that certain things at certain times you are not allowed to have sex. So when would those times be? One would be a woman who has a history of previous miscarriages. If the wife has had 1 or 2 miscarriages, the gynecologist will advise you not to have sex. So then you cannot have sex. That is for sure. Second, if there is some kind of vaginal or uterine bleeding. During pregnancy, sometimes there is something called as spotting. So if that happens, the woman has to immediately go to a gynecologist and stop having sex completely. That you are not allowed to do that. And something which you cannot do is, like if a woman is using a sex toy. If she is using a sex toy, she cannot insert it inside her vagina. She can only play it on the outside of her body. Because what would happen, a sex toy is normally something which vibrates, and the moment this starts vibrating, she may get an orgasm and it may trigger involuntary labor. So that is the reason why she should not use that. Okay, so far so good. Any questions or anything?
So how do you, which months sex is permitted?
See, I'll tell you, during the first trimester, what happens is most of the women, they get a lot of nausea and all those things. So first trimester, most of the women don't like to have sex. In the second trimester, that is 3 to 6 months, most of the women like to have sex. And the last trimester, what happens, because the abdomen becomes very big, so the woman finds it slightly uncomfortable to have
So the
sex.
second,
Yeah, but you can have right from the first semester till the second semester. Only in the third semester, big trimester, I'm sorry, because the woman's belly becomes very big, it becomes slightly uncomfortable. Later on we will see what they can do, like if they want to have sex, how they can have it. Okay, now certain things we need to remember. This was the sexual part of the whole thing. Now we come to something known as a relationship aspect during pregnancy. What happens during pregnancy is that the husband feels left out. The woman is pregnant, everybody is showering a lot of attention on her, and the husband feels left out. Now this is the time what happens, many husbands, they have an affair during pregnancy.
many husbands?
Have an affair during pregnancy. We think that how inhuman of him to do that, but what happens in reality is that he feels completely neglected because everybody is showering all the attention on the wife. Everybody is feeding her, everybody is taking care of her. The husband is sort of left out. So to fill in the gap, they generally get into an affair. And now, why do these affairs happen? Let us see. They are threatened by pregnancy, as I said, because the woman receives most of the attention. Now he feels that he is left out and he is like no good. Sometimes he has an affair because the woman's body becomes so different than what he is normally used to. She has a shapely figure and now he sees that she's completely disfigured, so he sort of loses sexual interest in her and tries to go to some other woman. Another of the reasons why he would have an affair is he is frightened of sharing his partner with a little baby. See, what happens is, like the media or the family or the films, they'll always show that, pregnancy and everything is such a happy event for everybody. There'll be sharing of sweets and everybody will give a lot of attention. But actually what happens when a woman gives birth to a child, she experiences a lot of depression, which is known as postpartum depression, which they'll never show in films. It's like, the mother is very happy, she's feeding the baby and, everyone is enjoying. But deep within, she feels very depressed for many reasons. But that they'll never show, and that's why we don't understand that a woman goes through depression. So even a way what happens is, like if he's got a very strong bonding with his wife, the moment the baby comes or is about to come, he thinks that now the attention will go to the baby, which most of the time happens. Like the mother is always busy with the baby and like the husband is not being paid attention to. These things cause a lot of relationship problems. I have personally seen it happening. And sometimes what happens is the husband is so worried about being a father. Normally again, as I said, like they'll show the husband is very happy, he's shouting over the rooftop that I'm going to be a father and all. But deep within, there's a lot of anxiety whether he's going to prove himself to be a good father or not. Because society places a lot of pressure on the parents. Oh, you have to be a good mother, you have to be a good father. And like there's so much of external pressure on them, which is never actually spoken about, but which is felt by the parent. So these things actually lead to a lot of extramarital affairs or even extramarital sex. The best thing to do in these circumstances is the wife has to, before she becomes pregnant, either she has to go for pre-pregnancy counseling about how to handle her relationship during pregnancy and after the pregnancy. So that would be like, if she's spending most of the time with her own mother, she has to spend some time every day with the husband. She has to connect with him on a daily basis, try to involve him in certain tasks so that he feels connected. I have seen this happening in so many houses where the child is born and the mother and the child are in a separate room and she is getting a massage and whatever, and the husband has no idea of what's happening with the wife and the baby, even in this time and age. So why such a thing? The husband should know what's going on in the woman's world.
I think both mother and husband also should massage the baby.
Yes, if they want. Of course, he has to learn how to do it, but then he can also do it. That's the way he can remain connected with the partner, which is very important.
I think even the father must be present during delivery time.
That they are present now. In some of these homes, they do allow the husband to be there during childbirth. Okay. Now, as this gentleman rightly said earlier, what are some of the positions which are comfortable for the wife during pregnancy? So these would be any position in which there is no weight on her belly. That is, understandably she cannot bear it, and no weight on her breasts also, right? So all those sexual positions are fine. And the technical words for them would be rear entry, that is, you are taking the woman from behind, or it would be side by side you are sleeping and having sex, or it would be the woman on top position, where the man is astride and the woman is riding on.
Side by side and facing each other.
Yes, facing each other, or even maybe their backs facing each other and he's penetrating her from behind. So these are very comfortable positions, and try to use a lot of pillows. Try to use a lot of pillows. The woman should use a lot of pillows so that there is no pressure on her abdomen. Fine. And coming to the last topic is sex after childbirth. As I said, normally for 42 days the husband and the wife are not allowed to have sex, because you have something called lochia, which keeps them emanating from the woman's vagina. So that has to come to a stop before they can resume sex. But having said that, sometimes what happens, some women, they start breastfeeding and they lose a desire to have sex, but the moment they stop breastfeeding, the sexual desire restarts. But with some women, what happens, even after they stop breastfeeding, the sexual desire does not return, even for a year or so. So then what happens, the husband gets very frustrated, and there has to be some way out. In that case, what she has to do is she has to go to a doctor who would prescribe her certain medications to counter the effects of prolactin. Prolactin is a hormone which is created in the body post-pregnancy. So if those levels are very high, she is not bound to have any desire. So once those drugs are taken, her desire would come back to normal. And certain other things which she needs to do is, we think that if a woman is breastfeeding, she will not get pregnant. We think like that. In olden ages, people used to believe that, but then if she's not having a period, she cannot become pregnant. But she may be ovulating without having a period, right? So it's very important that contraceptives are used during sex. Anytime after childbirth, contraceptives have to be used, and not hormonal contraceptives. She cannot take a pill. Ideally, she can use a female condom, or the male has to wear a condom, or she can use an IUD, which normally what happens when even in any part of the world, when a woman wants to complete her family, it's normally after the birth, IUD is normally inserted so that she can space her family.
These 6 months during these feeding, she can be pregnant.
Sorry?
During when she reaches with the baby 6 months, they have to use the contraceptive.
If she doesn't use it, if she's ovulating, she can.
She can.
Yes.
And she can't take the pills.
No. Because already a lot of hormonal alterations have taken place in her body. If she takes that pill, it will create further alterations in her body. So doctors and gynecologists will never advise her to take hormonal pills, either a female condom or a male condom, or an IUD. That will not interfere so much with her sexual mechanism. So these things we really need to keep in mind, because I have myself seen so many cases where affairs have begun and the wife thinks, oh my God, how can he have an affair when I'm carrying? But without realizing what is going on in the men's world. And that's why, as a sexologist, I believe that we in India still believe that pregnancy and something is something which only a woman should be concerned about, and the man has no right to know anything, or he need not know anything. But I believe it's very important for the husband to know most of what is happening to a woman. Sometimes if no help is available, what is he going to do, right? And the woman, like in our country, I have rarely seen a woman reading up a book on pregnancy. No, nothing is happening. She either calls up her mother or she goes to visit a doctor, and there are so many things which she herself does not know. So there is no sense of pregnancy literacy as such, which again is something which has to be ideal thing is that the man and the woman should read a book on pregnancy and then start discussing things, their relationship and so many, how they are going to bring up the baby, because once the baby is born, then there is no time. Most of the time she is busy with the child. So these things have to happen simultaneously while she is pregnant. But unfortunately, it's not happening in the way it should. That's the sad part. So probably probably you two gentlemen, what roles you can play is, suppose you have suppose somebody comes to you for advice, so probably you can give them the right advice, rather than you had a myth in your mind that sex should be avoided during pregnancy, but now I suppose that myth is cleared from your mind. So if somebody comes up to you for advice, a man or woman, irrespective of their age, you can give them the scientific facts and let them have a normal sex life. What is so big deal about it?
After the child's baby is born, do these mothers go post-depression?
Sorry?
After the baby is born, that mother goes post-depression.
Yes.
What she should do?
No, she doesn't have to do anything. What happens is, that will, because sometimes because of altered hormonal levels, she goes through depression, and the husband has to convince her that, he still likes her. Because what happens, she becomes depressed because a lot of stretch marks and things are like that on her abdomen. So she thinks that, the husband will not love her in the way he used to love her before the child. So the husband has to convince her that for me, you are still the, the right woman or the right person for me. And after some time, once her health recovers, she has to, she will come out of it on her own. But this is something, or she can even go for a postpartum counseling. If she's a good gynecologist, she will definitely guide her about these things. But if she goes to a very common gynecologist who's seeing like so many women in a day, she'll just give her some medication, she'll say, okay, you go now. But that's actually not what is required. She needs sympathy, she needs kindness, she needs understanding. So then I guess things should be fine.
Other question is, why this nowadays we find that lots of money making is going on, like not natural, it should be natural delivery, not cesarean. So lots of
Okay, why so many cesarean deliveries?
No.
See, I'll tell you.
I have been in the hospital in New Bombay. Cesarean is so much very expensive, natural delivery is very.
See, I'll tell you what happens. There can be many reasons. 2 or 3 which I can cite is, first of all, if you've gone to a greedy gynecologist, because when you do a caesar operation,
In the newspaper, one girl went to 3 gynecologists. They said no, you have to do cesarean. Then she went other. She had a natural delivery.
yeah. See, what happens, one of the reasons is that gynecologists are there to terrify you. And they will terrify you because you don't know much about what's happening to your own body. And that's why, as I said earlier, a woman and her husband both needs to understand that having a baby is a very natural process. So first of all, if you've been to a greedy gynecologist, if he operates her through cesarean operation, he is going to make double the amount, right? So that is the first thing. Second thing, what would happen is the woman is very terrified. It's going to hurt me, I cannot bear the labor pains. Okay, fine, go through cesarean, get rid of the problem. So that is the second thing. Third thing, only in exceptional cases where it is actually required, where it would cause death of the mother or the child, that is the only legitimate reason to actually go for cesarean section. But then as what is happening is there are no ethical standards. See, I want to give a very good example that with Aishwarya Rai Bachchan. She went for a natural delivery.
Yeah, in certain hospitals. Yeah.
Yes. So like she has set a good example for other women.
Even in the SAN hospital, I was reading an article in the SAN hospital, most of the delivery, natural. But in private, there is sinking.
See, because you can make much more money,
Money, yeah.
You can make much more money, and it is so easy to terrify people.
Yeah.
It
But they
is-
don't know about medical knowledge.
Yeah. It's fine. Like if the woman says, I want it this way, okay, fine, you can have it that way so long as you pay me. It will only be very few ethical doctors who will, warn you of certain consequences.
How to know the gynecologist is greedy, How to know the gynecologist is greedy?
Sorry, how do I know that?
This doctor is greedy,
No, how do I know?
No, how this, the girl should know that this gynecologist is a greedy doctor.
No, probably, what? First of all, I tell you, when she decides to hire the services of a gynecologist, she should visit at least 3 or 4 different gynecologists and see how comfortable she feels with the man or the woman. Because what happens, she has to develop a very close bond with the lady doctor. And I would, as a man, I would suggest that a woman go and see a lady gynecologist, because she would feel much more comfortable talking to her than talking to a male. Because a man has never born a child, so it's very difficult for the male gynecologist. Though theoretically he knows everything that's happening to the woman's body, but certain things the man can never experience. So it's very difficult for him to actually put himself into the shoes of the woman and think, oh my God, this is happening to the woman. So I would advise as a male that a woman should go to a lady gynecologist. And that is one thing. And secondly, she should check out the services of 2 and 3 gynecologists and take references from women who have been to gynecologists and have really helped them. So then she should, select a particular gynecologist.
She should tell the doctor that I want to go for natural delivery. So that
Sorry?
she should tell the doctor that I want natural delivery.
No, even if she says the doctor can terrify her, what is she going to do? So that's the reason why I say that if you have somebody like, a family contact or somebody can refer you, that's best. Otherwise, if you don't have those kind of referrals, at least go and check out 2 or 3 doctors and see with whom you feel comfortable. Because once you talk, you will immediately know. See, one of the catch signs of a greedy doctor is that he will tell you to hurry up. He will tell you to hurry up with everything. You make your payments today, you make your do things that you do this. So somebody who is trying to hurry up things, it's a very, very telling sign that he or she is very greedy. Never ever believe somebody who tells you to hurry up with things. Make the payment today, do it tomorrow. Somebody who is genuine and authentic will never rush into things. They will allow you to make your own decisions. I get so many patients who will tell me, okay, I never tell them, okay, you have to come tomorrow and you have to come day after tomorrow. There are certain patients, they say, no, we are feeling very shy to come and meet you. I said, okay, you take your time, you get rid of your shyness and then you can come to me. I don't tell them that if you don't come tomorrow, you're going to die. Right? Because I know what I am. So, you have to give them that space, because everybody needs to, we are different individuals. Just because I'm educated, I don't have inhibitions, but there are so many people who have inhibitions. So you have to give them that time to get rid of the inhibitions, let them talk to 10 people and then come and see me. So, that comfort factor with the doctor has to be there. And that has to be there not only when you are selecting a specialist, but with any kind of person you are working with. If you are not comfortable working with the person, you will not be able to do any kind of deal with the person.
But if there is no judicious choice, I have seen children developing cerebral palsy because cesarean was not done. Child gets suffocated.
No, but I'll tell you something. For certain things, when you are saying cerebral palsy and all, there are so many reasons why these things happen. But if you are in the hands of a trusted gynecologist,
Suffocation during the birth passage.
No, but then as I said, if you are in the hands of a specialist and a trusted gynecologist, you have to obey them. You have to obey them. You see, I'll give you one example. Like one gynecologist to whom all my sisters and all went, very, very professional gynecologist in Calcutta. He will never cheat you. There has not been a single case reported against him of he trying to, manipulate women into believing that you need a cesarean. Nothing doing. He very, very frank and down to earth. And that was the reason that even though he was 85 years old, he had begun his practice, I think, when he was in his 30s. And women right from the age till the first time they met him, till the age of 85, 90, till he died, women wanted to go him for all their problems. Whether it was gynecological or pregnancy related problems or anything. So that is the kind of faith women had in him, that no, this man will not they will not cheat me. He will only do what is required and will not tell you to do anything extra. So once you can develop that faith and you develop a goodwill, there is nothing like, beyond that. It's goodwill which will actually work. And once you are a cheat, you get the reputation of a cheat, trust me, very soon word of mouth happens, and then you lose your practice. Like, obviously one woman is going to go and tell another woman, her friend or somebody, that so and so doctor is not the right kind of doctor. No, many of them. Many of the doctors are there who still have their own ethics. And there are so many of the doctors who don't have any ethics.
Natural delivery, they should have exercise, light exercise, walking.
It's called lamaze. There are so many, like pre-pregnancy exercises which the woman can do.
They should attend classes also, pre-pregnancy classes.
Yes, but that is something, I have seen very, very few women get into those classes. It's a very new concept still. Women will just, probably do the normal household work, but I have yet to meet someone who is really exercising her way to the delivery. Or even like something what is known as a water delivery. Even that is very uncommon in our country. Where, they have a small pond kind of thing, and, they deliver it. Yes, that's much more comfortable, it's much more healthier. But we don't have these concepts over here. They are very European and American concepts. Yes, absolutely.
When the baby is in the womb, water is there, so the baby is
No, because it's immediately picked out. It's immediately picked up. These are very safe things and they are much more effective. But then these things will take a lot of time to come to our country.
Even hypnotherapy also help in natural delivery.
Yes. Hypnotherapy does help. Even music helps. Certain
injections of oxytocin and all that.
Sorry?
Sometimes people give injections of oxytocin.
No, injections for oxytocin are very harmful. If you take the natural way of creating oxytocin in the mind, that is fine. But artificial injections and all are never advisable. Only under the guidance of an experienced endocrinologist can you take those things. Otherwise it can really backfire. You cannot, in fact, no good endocrinologist will give you an injection of a hormone because you tell them to give it. It's always under the expert guidance of an endocrinologist. You cannot take it.
Yoga, breathing exercise.
Yes.
I know one girl, she used to practice yoga and she used to do breathing exercise.
Yes.
She had a natural delivery.
Yeah.
During delivery time, she took a deep breath and
Because she has prepared her womb in that way. We still lack a lot of awareness. I have, as I said, I have not heard any woman exercising before pregnancy. She will maybe just take a walk here and there, but beyond that, I have not seen them. Only eating and sleeping, but no exercising, I have not heard. I have really not heard.
exercise is must. Which exercise to do? We have to consult the doctor. And
Consult a yoga expert. Doctors will not know that much. You have to see a yoga expert, they will tell you which exercises to do. Again, something which is less training on the abdomen.
I think walking is the best. This walk.
And there are certain asanas also which you can do. Asanas, and as I said, those techniques are called lamaze techniques. So those actually ease the process of childbirth. We have these pre-pregnancy classes in Kokilaben. Yeah, they have that. And I think even Leelavati has those kind of classes, prenatal classes.
I have in the whole family hospital also they have.
They would have. Some of the big hospitals have, and some of the private clinics also have it. So those are the places where women should go. So any more questions, or should we call it a day? As I said, this was a small session.